Hello, welcome to my presentation for the SECU Public Fellows Internship. My name is Shruti Temkar, and this summer I served as an intern at Project Momentum. I'm graduating in 2024, and I'm currently majoring in neuroscience with a minor in medical anthropology. I'd like to begin my presentation today with a discussion of why I wanted to pursue a Public Fellows internship in the first place, and what I intended to gain from it. Throughout my undergraduate studies, I had become drawn to the idea of social determinants of health, the idea that health is beyond what we see on the surface in terms of physical ailments, but instead it's a manifestation of deeper structural issues. I learned that a person's zip code, or salary, or race/ethnicity can determine their personal health more so than any personal choices they make. My experiences with social justice clubs like UNC Flourish, which focuses on food insecurity and nutrition, and Apple's Spring Break program, it really confirmed my desire to pursue this idea further. So naturally, as I was gearing up for summer, I was looking to gain some real-world experience, and I was drawn to the idea of conducting community-based research for public health issues in my future. So this is what led me to Project Momentum. I learned that they were conducting a research project called Addiction Algebra, which I'll explain in a moment, that sought to assess and decrease substance use in Rocky Mount. And I was really curious about learning how to conduct community-based research. How do you apply for grants? How do you write a research paper? How do you present that knowledge in a meaningful way? And I really resonated with their research aim to understand the broader structures that contribute to greater substance use rates in Rocky Mount. I could also see parallels for how I could apply this knowledge in my own way, with my own vision for social justice. My internship at Project Momentum focused on addiction algebra, which is a research project funded by the Kate B. Reynolds Foundation that assesses the root causes and the systemic issues that contribute to substance use and misuse in Rocky Mount. Through interviews with local community members, we also hope to gain insight into recommendations for future program designs to meet the needs of people with substance use disorders and to reduce substance use rates in Edgecombe and Nash counties. Another interesting fact about this program is that it also sought to understand how COVID-19 impacted substance use rates within Rocky Mount. Originally, the project started in 2019, but throughout the pandemic and as they've continued throughout the years, we have evolved and adapted it to account for COVID-19 too. So on the slide are just some of the key research aims that we sought to cover. So just to elaborate on that, we sought to answer the questions: what life circumstances, trajectories, or transitions contribute to the different stages of the substance use continuum? Substance use continuum meaning different stages of substance use, initiation, experimentation, and then addiction. How do all of these circumstances impact that along the entire timeline of substance use? We also sought to answer what social determinants of health impact the various stages of substance use continuum and how do they impact the continuum. We also sought to answer what assets and challenges exist to address the different stages in the substance use continuum, as well as recommendations for addressing the different stages of the substance use continuum. Addiction algebra also utilized the socio-ecological model to kind of explore the multifaceted nature of substance use within Rocky Mount through the lens of diverse community members, such as counselors, teachers, policymakers, church leaders, and many more. So my principal investigators, Misha Wynn and Amber Henson, they conducted interviews in the policy, organizational, and community domains, as well as with people with interpersonal and individual experiences of substance use to kind of get a broader spectrum and a broader understanding of how substance use is uniquely impacting Rocky Mount. So besides my work in addiction algebra, I'm also helping to develop Project Momentum's IRB, or Institutional Review Board, to kind of help them become a more independent research organization and to have them publish their own research more easily instead of having to rely on academic institutions to do the same thing. Doing so would also help to encourage other local researchers to publish their work and kind of collaborate or foster collaboration amongst local talents. So I was tasked with researching how to set up an IRB and find out other local IRBs that may already exist in the Rocky Mount area and contact those established IRBs to understand how they got started. So this is really a big step forward for Project Momentum in terms of gaining independence as a nonprofit community-based research center. This experience was really enriching to me in the sense that I understand that I enjoy community-based research, and I now know that this is something I want to pursue in my career. I think it's just so valuable having that chance to sit down with someone and ask them, what do you think we need? I feel like that's just information that you cannot find anywhere else except through that one-on-one contact. It's also reaffirmed that I truly am passionate about fields such as psychiatry and mental health, and I really do desire to help underserved populations and to spend the rest of my life better understanding the social determinants of health. I think that in listening to people's stories with substance abuse through these interviews, I've developed sharper interpersonal skills as I learn how to hold space and compassion for people in their most vulnerable moments. I've had to challenge my own prejudices and dig deeper to look at mental health and substance abuse beyond simply a physical ailment, but as a reflection of where we let our most vulnerable people fall through the cracks of a system that doesn't necessarily serve them. So as I move forward in my path to becoming a physician, I hope I carry these lessons with me, and I hope I have the grace to understand that a person's health is just the tip of the iceberg. As for the community impact, the implications of these research findings are incredibly important. From these findings, we can understand what substance abuse treatments already exist, what needs to be improved, and how we can get people to be more aware of the treatment options that are out there. We can gain insight into what these community stakeholders believe should be implemented within our laws and policies to best support those with substance use disorders. It just also shows the Rocky Mount community that there are people who care, and there are people that are willing to work hard to improve their community. So it really helps to build that sentiment of mutual trust and respect amongst community members. I also did experience some barriers and challenges throughout my internship, one of which was imposter syndrome. Before I started this internship, I feared that my institutional academic background or my status as an outsider might limit important conversations we could have about our research and our work. Although I don't personally relate to the struggles of living with substance abuse, or I may not know what it's like to live in Rocky Mount, Misha and Amber never failed to make me feel welcome and a valued member of this research. I really had to acknowledge that I will never know everything that there is to know, but just simply by being curious and showing up, I could help make a difference. So in my own way, with my own vision for social justice, I also hope to pursue community-based research with the same excellence that Misha and Amber have applied to their work. And as for the future directions with this project, we hope to disseminate our research findings to the general public of Rocky Mount within a town hall style meeting, just so that we can kind of allow the public to be aware of what we have accumulated throughout the years and allow them to be able to reflect back and ask questions. So I'm not sure whether this will be done within the timeline by the time I finish my internship by August, but I do hope to attend it in the near future. So that is the end of my presentation, and thank you so much for listening.